Okay. Case 2 is a 50-year-old man with a 2-centimeter inguinal mass. If only we always got histories and info with, the actual size and all that stuff, but sometimes we don't. But I wanted to give you guys some classic, info. All right, so let's take a look at this one. Who wants to take this?
I can take it. So we have a vascular looking lesion. There's also spindle cells present, but they look fairly bland, no real increase in mitoses. Kind of has some areas that are more open and edematous than others, whereas others appear a bit more dense. Maybe a little bit of inflammation present, and maybe an area or two of some entrapped adipose tissue.
Yeah,
So
good.
I was thinking along the lines of a cellular angiofibroma, but also considered sort of like a fat poor spindle cell lipoma, or maybe even an SFT.
Wow, what a rock star! Fantastic. Yes, that is an amazing differential. Who was this? Who answered that one? My little window has disappeared.
I'm Peter, one of the first years.
Okay, you're a first year. Man, that's fantastic. Well done, sir. Well done. Yeah, that's a perfect differential. Is there's a little bit of fat here, and but we have a lot of bland spindle cells with abundant kind of bundles of collagen in the background, kind of ropey collagen. Look at that waviness. That waviness, it often makes people think of neural things, right? But nerve usually nerve can be a little bit wavy, but not dramatically so. I also find that fibroblastic entities usually actually are much more wavy than neural things. And I've got a little video about that. I refer to that as the ramen noodle sign. One of my former fellows, Ed Fulton, came up with that idea that collagen gets really wavy in dense regular connective tissue, and a lot of fibroblastic tumors do the same thing. So when you think you have a neural tumor and S100 is negative, always think of fibroblastic things, particularly spindle cell lipoma and related entities. So this, like you said, this is actually a cellular angiofibroma, and it is probably closely related to spindle cell lipoma. And because of that, it has a lot of similar features. So I feel like it's an entity, there are several entities we'll talk about today that are related to spindle cell lipoma probably, and may exist kind of in a loosely knit family. And so you can learn multiple entities for the price of one because they have overlapping features and they're all benign and they have similar immunohistochemical findings. All right. So yes, fat is often present in cellular angiofibroma. So when I see something that looks kind of like spindle cell lipoma, but it's in the genitals, it's probably a cellular angiofibroma. They do, as the name implies, tend to have a lot of vessels, and the vessels can be these kind of staghorn ectatic branching vessels, which make it resemble solitary fibrous tumor. And these cellular angiofibroma, just like SFT and just like spindle cell lipoma, they're usually CD34 positive. Sometimes they can express some actin and desmin as well. And one thing I think is pretty helpful for this entity and also for spindle cell lipoma and other related entities is this packeting or parallel arrays, is what Dr. Weiss liked to say, or to me they're kind of like palisades, right? The nuclei kind of line up in a little row together, and you can see as you look around these little clumps and groups of the bland spindle cells clumped together, and then in between there are zones of hypocellularity. It's not like the beautiful palisades that you'd see like in a schwannoma, like in a Verrier body, but it's kind of this subtle palisading. And sometimes it's very nice and real pretty like this here. Other times it's very, very subtle, and I have to convince my residents and fellows, they're like, really? That's not palisading. So, we do have to kind of hallucinate a little bit sometimes in pathology to see the subtleties. But I do think that finding subtle palisading in a spindle cell tumor is really useful, and it right away makes me think of spindle cell lipoma, cellular angiofibroma, and other entities. And just like spindle cell lipoma, look, mast cells, often scattered mast cells in the background. You can have some myxoid change. What's the more recently described immunostain marker that is potentially helpful here in sorting this out from some other entities?
Loss of RB1.
Yeah, RB1, exactly. The retinoblastoma gene is often lost in spindle cell lipoma and in cellular angiofibroma and other entities. And so you can do FISH for that, and it'll show like monosomy. It'll show a single copy of RB1. Or you can do the immunostain, which will show loss of RB1 in the majority of the lesional cells. And that's not in 100%, but it's in the majority of this entity. And this is another entity that Dr. Laskin published about, and under the name of angiomyofibroblastoma-like tumor of the male genital tract. And for a while, there was a thought that maybe these tumors were more common in men, but over time, as we've looked at these, we've recognized that they can occur in both sexes, both men and women, in the genital region usually. And that they probably, the entity that Dr. Laskin described, now people refer to as cellular angiofibroma, and I think most people will see if Dr. Laskin agrees, but that they probably represent the same thing. And so what if you called this a spindle cell lipoma instead of cellular angiofibroma? Nothing bad would happen. It wouldn't matter because they're both benign. They're usually cured by simple excision. So don't worry about making that distinction. Basically, if I think it's a spindle cell lipoma, but it's in the genitals, I'm going to call it cellular angiofibroma. I don't know if that's right, but that's the way that I approach them personally. So, and for SFT, the marker that you could do if you were having concern there would be STAT6, which is going to be positive, and RB1, to my knowledge, is not lost in solitary fibrous tumor. And that can sometimes be important because occasionally SFTs can have atypical features that might give a little bit different need for management. And but when they're that's a kind of a more complicated topic for another day, but making that distinction can be important. So the nice example of a cellular angiofibroma, and I like to say of the genitals because there are like 6 different things, I think, in soft tissue pathology named angiofibroma. It's getting like a little bit crazy. And it's no wonder why people find soft tissue pathology hard, because all the names just take like lipo, myxo, fibro, angio, and like combine them together in any different way, and you can make all these totally different tumors that have very similar sounding names. So it's a touch maddening. And here's again that nice palisading bland spindle cells, slightly wavy, some thick bundles of ropey collagen, cellular angiofibroma of the genitals. Very nice. All right.